Thank you so much. We will begin our press conference. We have a number of speakers here to launch the Canadian Rare Disease Network. We will have time for some questions in the room and any questions online. However, we do have to wrap up by around 10:15 just because we have some other commitments in this room. So just to get started, I will hand it over to the speakers.
Thank you very much, and thank you very much for the opportunity to be here this morning. My name is Durhane Wong-Rieger, and I am President and CEO of the Canadian Organization for Rare Disorders. And this is, of course, for us a very important day. It is the rarest day on the calendar, and that is February the 29th. Happens once every 4 years. It is, in fact, Rare Disease Day. And to be honest with you, we had really hoped that this Rare Disease Day was going to be a really full-throttle celebration. We've been working hard, certainly over the many years, but leading up to in terms of this year, working with our hospital, patient, research partners. And we do have some wonderful news to announce today, and you'll hear a little bit more about it later, and that is the launch of the Canadian Rare Disease Network, the first in Canada. And it's a great achievement, and Dr. Bernier here, he's going to have more to say on this a little bit in a few minutes. And we're really thrilled, want to congratulate everybody that contribute to making this happen. This new network, as we say, the first in Canada, right across Canada, is going to do a great deal to make sure that we're able to screen and diagnose patients with rare diseases as soon as possible, making sure that we get the right care and treatment for our patients and the support for the families. And of course, this network will be involved in terms of research in Canada and clinical care, clinical network research across rare diseases. So it's a big step forward for us here. But I really have to say there's a huge but here, and that is one of the most important aspects in terms of care for rare diseases, and that is treatment. We have been hoping that this was in fact going to be the time in which we could have funding for the new drugs for rare diseases, the new treatments, but unfortunately we are still waiting. And as we say, patients no longer have any patience. We have every right to be impatient. It's been more than 5 years since the federal government first announced that we would have a rare disease drug strategy. In 2019, they announced $1 billion. That was really, for us, a big sign that people were paying attention to the 1 in 12 Canadians with a rare disorder, and we really had hoped that we would see the action helping. But in fact, now we're still waiting. Last March, we stood up with the Minister of Health when he announced that they were in fact going to be providing $1.5 billion for access to drugs for rare diseases. And that big part of that, $1.4 million, was going to go directly to funding new treatments and equalizing the treatment that's currently available. But I'm very sad to say that here we are 1 full year later, and of that $1.4 billion that was announced, not one patient has received 1 penny for a single treatment for rare diseases. Nothing new has happened. And we are definitely, as Canadians, as family members, out of patience. So this is what we're saying today. Over this period of a year, we've had patients who not only been waiting for drugs, but patients who've deteriorated because they couldn't get access to the drugs they needed. We're talking about severe, progressive, life-threatening conditions. And in fact, for many of these conditions, the wait for a year has been far too long. Certainly the wait for the 5 years has been absolutely excruciating and really in many cases devastating. So we understand, we appreciate, and we've been part of the negotiations and the organizations of trying to get a new structure set up. But really, we believe that we could, in fact, do 2 things together. Put in place the bigger agreement, but also at the same time start to fund the drugs for those patients who are in waiting. And you're going to hear some of that very directly here. I mean, it's kind of like we usually say, you know, if we're trying to fix our healthcare system, fix our hospitals, we want to fix long-term care, that's going to take some time. We get it. But you don't close your ER. You don't keep patients who have urgent needs from getting access to those, to care for those needs while you're waiting. We can do both, and we have to do both. Because we do, again, we have patients' families waiting. And we know how to do this. We do this now in terms of providing early access while we're actually waiting for, you know, more permanent kinds of solutions. And many countries know how to do this. Bring in the drugs, get people started. The biggest wait is really around negotiating on the right price for drugs. We can do that over time. We don't have to wait until all that's done. So this is what we're talking about. We have proposed to the governments an implementation plan. We've been working with our partners to really figure out how we can get these drugs to people as soon as possible. And really, we have gotten drugs right now, at least a dozen drugs, 12 to 15 drugs, approved by Health Canada as being safe and effective, recommended by the health technology assessment groups to say that they're cost effective and they should be made available to people. We've got diagnostics that are in place. We've got the support to actually make them available, so we know that we can do this both safely and effectively. And in fact, it's almost tragic when we think about it. 2 of these drugs are actually ones that are actually Canada is the first country in the world to approve these drugs, and we still can't get them to people. So this is what we're talking about. The drugs are here, the approval is here, the monies have actually been promised, and if you can imagine, if you're a patient and a family waiting for this, what a tragedy this is, how devastating this is. So we're here to say we need to fix this now, and we can fix it. The solutions are actually right in front of us. So this is why we're here, and this is why we're going to be bringing our community to Parliament Hill this morning. We really need to bring the message across that we want to be able to provide access to patients right now, because we've got the monies promised, we've got the drugs ready, we've got the specialists that are ready to treat, and the patients are absolutely in need. It is an urgent situation. So thank you. Our patients are definitely out of patience. We need the treatments, and we can't afford to wait any longer.
Merci Durhane. Bonjour à tous. Merci d'être parmi nous ce matin. Tel que mentionné par notre leader Durhane, nous avons plusieurs réussites à célébrer en cette journée des maladies rares, telles que la création du réseau canadien des maladies rares, que l'on annonce aujourd'hui. C'est vraiment une étape très excitante. Ce réseau vise à aider les patients à accéder à de meilleurs diagnostics, soins et traitements pour les maladies rares, tout en aussi favorisant la recherche et une plus grande collaboration clinique à travers le Canada. C'est une étape extrêmement importante pour finalement améliorer les soins des Canadiens atteints de maladies rares. Cependant, il nous manque toujours un élément essentiel pour véritablement célébrer cette avancée et offrir de meilleurs soins aux Canadiens qui vivent avec une maladie rare. C'est quoi ce chaînon manquant? C'est le financement promis par le gouvernement fédéral pour ces maladies contre les maladies rares. Ce financement a été promis pour la première fois en 2019, il y a 5 ans. En mars dernier, le gouvernement fédéral a annoncé sa stratégie nationale en matière de maladies rares et son plan de dépenses de 1,5 milliard pour les traitements, la recherche, l'évaluation et d'autres initiatives. La grande majorité du financement, par exemple, est destinée à investir dans les médicaments contre les maladies rares. Ça signifie plus qu'un 1,4 milliard de dollars. Toutefois, à ce jour, aucun financement de nouveaux médicaments n'a été alloué et aucun Canadien n'a pu en bénéficier. Les patients canadiens sont tannés d'attendre. Notre message aujourd'hui est clair. Les patients, leurs familles, les professionnels de la santé exigent que les fonds soient immédiatement alloués, afin que les patients peuvent finalement avoir accès à des médicaments qui peuvent sauver leur vie. En tant que directrice générale de la Société de la sclérose latérale amyotrophique, qui est une maladie neurodégénérative dévastatrice et actuellement incurable, moins de 10% des patients ont accès à des traitements novateurs. Ce qu'on demande aujourd'hui, il est temps de passer à l'action pour que les patients avec la SLA ainsi que tous les autres Canadiens atteints de maladies rares puissent avoir accès à des soins et à des traitements dont ils ont besoin pour survivre et aussi pour bien vivre. Merci.
Bonjour, je suis Dr François Bernier. un généticien et chercheur de maladies rares de l'Université de Calgary. I'm a rare disease academic clinician, genomics researcher. And I think what we're going to hear today is a passionate voice that's going to include patients, families, people that are more than just a disease, like we're going to hear from Madi. I think we're going to try and understand how we move forward together in a way that improves outcomes for so many patients that feel lost in the system. Caring for patients with rare diseases has been my lifelong passion. Like we're going to hear from Madi, we're going to be taught by Madi. And I think we should just listen to Madis, the Madis of the world who live with diseases but have their opportunities to have their lives transformed. They teach us a lot. They've taught me a lot. They've taught me about resilience, perseverance, their lived experiences. But man, do they teach about their lived challenges. They also teach us about hopes and dreams. They're more, and please, they're more than just these rare diseases. Most people have never heard the name of these conditions. They're more than that. They're more than that. So, unfortunately, as we've heard, the challenges are real, and these are systemic challenges. They're not about the patient's challenges. They're doing great. It's the system around them. It's the system that doesn't provide access to a diagnosis, doesn't provide access to therapies that are available, doesn't have a robust pipeline to new discoveries for disorders that have no treatment. It's unfair that if you were to have diabetes that's treatable now by insulin, we have diseases that are exactly like this, that are completely untreatable. Patients die of these things as you would have died of diabetes 100 years ago. So the system can improve. There's another part of the system that can help. It's the patients are left alone. They're left in a community of trying to work together. CORD, our QMOs support them. We can do a better job of supporting families. So aujourd'hui, on annonce le Réseau canadien des maladies rares. Notre travail se concentre sur 3 piliers interconnectés, les diagnostics jusqu'aux thérapies innovantes, en passant par les soins, le soutien et l'autonomisation. Notre but, c'est de connecter la communauté canadienne des maladies rares pour faire progresser les soins, la recherche et l'innovation. Today, great fanfare. It's amazing to do it here. We're launching a Canadian Rare Disease Network. The CRDN is a pan-Canadian, cross-disciplinary network that aims to unite the country's leading clinical, scientific, patient, and industry experts to address the unique, incredibly unique, the incredibly huge, and the incredible opportunity to transform the lives of patients and families with rare diseases. With seed funding from the Canada First Research Excellence Fund, this is a federally funded program. It funded a program called One Child, Every Child. We're seed funding the network. We have great partnerships, the Canadian Organization of Rare Diseases et le Réseau québécois des maladies orphelines, RQMO. The network will aim to be a catalyzer of transformational change for patients with rare diseases, their families, but more importantly, the community of rare disease patients. I must say, I don't think I've ever felt as energized by the opportunities in rare diseases that we're starting to see materialize, that are starting to grow. The challenges are real, they are surmountable. I mentioned a project called One Child, Every Child. And I wonder if maybe the similar mantra applies here, a similar calling. That the aspirations, the hopes that we all have for one rare disease patient, one rare disease family, one rare disease community, that why don't we make those aspirations and hopes available to all rare disease patients, families, and communities? We want the CRDN, in partnership with all of our rare disease members, communities, clinicians, academics, industry partners, government funders, to be a driving force of change. Thank you.
Hi, my name is Madi Vanstone. I'm 22 years old, and I was diagnosed with cystic fibrosis when I was 8 months old. I had a really, really traumatic childhood. I spent majority of the time in the hospital, which made me just really sad. I was a really sad kid. I missed out on time with my friends and my family, fell really behind in school, so it definitely affected my education. Yeah, just a sad childhood. And by the time I turned 11, there was a clinical drug trial for a medication called Kalydeco. Kalydeco is a gene modulator, so it actually corrects the defective gene in my body, and within 30 days of being in the trial, my life had transformed. However, when the trial ended, I actually lost access. I was lucky I had a community that was able to raise money. The drug was $348,000 a year. Obviously, that's not sustainable. So my mom and I, my family and I decided that that was not okay. So we went to the government and we had to fight for 2 years to gain access to the medication. And when we gained access, there were still kind of criteria and whatnot, which is unacceptable, especially when you're looking at patients with terminal illness and stuff like that. It's really not okay to leave patients suffering for 2 years. It's a long time to fight for a drug. All these years later, I'm 22 now, still kind of fighting for the same thing. We learned that tons of different diseases are having the same issue with drug access. This is not acceptable. I am happy to be here today, but I shouldn't have to be. I'm lucky. I'm on a medication. I'm doing well. But there are a lot of patients that are still suffering, and that's why I'm here today. And my hope is that this is not going to go on forever. And again, that's why we're all here. We're fighting for the same thing. Thank you.
Thank you very much to Madi, to Jida, who's the vice chair for court and also the head of ALS Action Group, and to François Bernier, who's been a real leader in terms of putting together the Rare Disease Network. We're happy to take any questions that there might be.
Thank you. I would ask anyone who's joined online to please raise their hand for any questions. In the meantime, given there aren't any questions in the room at this moment, I myself am a journalist. I work for CTV National News, and I just wanted to ask a question, if that's okay, if we have the time, while we wait for any others. One question I have, and feel free to answer whoever is best suited, whether it's Durhane or Madi as well. Today, the government is expected to be tabling some legislation for a national pharmacare plan. I'm just wondering if you have any expectations of how that might help people with rare diseases, or if you have any concerns given the promises that you've said they haven't kept in the last few years, how they're going to uphold this.
I think it's great that we're going to be able to see pharmacare, hopefully equalizing care for patients with more common conditions. This actually, we have already had the promise for an orphan drug plan 5 years ago. And we're really terribly disappointed that, in fact, that has not been actually made into a reality. So the fact that, we don't begrudge anybody else for having access to therapies, but I think, as François says, every patient, and certainly rare disease patients, have every expectation that we should be able to get access to the medicines that are available. And as we say, the challenge is right now, we've got a promise of a plan. We've got the monies that have been allocated. What we're frustrated about is that we have not seen then the action plan to actually make those monies available to patients. So it is good. We recognize that there is, in fact, this movement forward, but, for us, it's not going to do a lot until we get the government to actually start to dispense the monies for the rare disease. The money's there.
Thank you. Would anyone else like to respond? That's okay then.
Yeah, I'll chime in. I mean, it's a model of funding drugs, and so that's a good thing. And obviously, any patient deserves access to therapy in Canada, and it's going to plug a gap, and we're proud to see Canada do those things. And no one wants to play the who gets the ice cream cone. So let's not play, from our perspective, who gets the ice cream cone. Let's just share them. So let's try and share those resources. And there is a plan afoot, and I think we can enable that plan.
Thank you. There are no questions online at this moment, so that would conclude our press conference. Thank you.
Thank you very much.
Thank you.
Thanks for tuning in on that.
Do you want to get a single picture?
I think they've done all the pictures.
We got lots of pictures.
Got lots of
Got lots.
pictures.
Okay.
Yeah. I think we got lots of pictures. Thank you very much. Thanks for having me. Thank you.